Picture this. It's 7 a.m. Your patient is prepped, the surgeon is scrubbing in, and you are settling at the anesthesia workstation. When the machine quietly prompts, based on your patient's weight, history, and today's procedure, here's a suggested agent regimen. No scrambling, no early morning mental arithmetic, just intelligent support exactly when you need it. This is not science fiction anymore. That's episode 4 of Anesthesia and AI in Rapid Sequence Intelligence. Welcome back, everyone. I am Dr. Saneesh. Today we are stepping inside the operating theater itself. AI in your anesthesia workstations, in your monitors, and everyone's favorite segment, documentation. Let's get into it. Before we dive in, a quick recap for everyone joining us fresh. In episodes 1 and 2, we covered the basics, what AI is, what machine learning actually means, and why it matters specifically in our world of anesthesia. And last episode, episode 3, we zoomed in on something a little different, Microsoft Copilot for your everyday Word and PowerPoint workflows. Incredibly practical stuff, even outside the OT. Today we are back in the clinical line. So buckle up. All right, let's start at the machine itself. For decades, the anesthesia workstation has been about mechanical precision, vaporizers, breathing circuits, ventilators. But in the last few years, the machine has started to think. The most talked about leap is closed loop delivery systems. That is where AI takes over the control loop. The system reads real-time patient data, BIS, that is bispectral index for depth of anesthesia, hemodynamics, respiratory parameters, and automatically adjusts the volatile agent or propofol infusion rate without the anesthetist manually dialing it in every few minutes. Think of it like a cruise control, but for anesthesia depth. You set the target, the AI maintains it. Pilot studies with systems like MUX-Sleepy and the eye control platform have shown remarkably stable sedation levels, sometimes outperforming manual titration in consistency. Now, I want you to be clear. This doesn't mean the anesthesiologist is sidelined. You are still the captain. But imagine not having to constantly micro-adjust because something novel changed. Your attention is freed for the things that really need your brain. Unexpected bleeding, ventilation problems, taking the surgical team through a tricky moment. Then there is AI-assisted drug dosing. Companies like Fresenius Kabi have incorporated target-controlled infusion models, pharmacokinetic models that predict plasma and effect site concentrations based on patient demographics. AI is now refining these models with population-level data, making them more personalized. And we are seeing AI enter the pre-anesthesia phase 2. Sometimes some workstations now pull in the patient's pre-op data like weight, ASA score, allergies, prior anesthesia records, and generate a personalized drug regimen suggestion before you even walk into the room. Like having a very fast, very thorough registrar who's already done the homework. The big vendors, GE Healthcare's CareStation, Draeger, Mindray, they are all investing heavily here. We are not talking about futuristic prototypes. Some of these features are landing in machines being installed right now. Now let's talk about monitors, because this is honestly where AI is making some of its most exciting inroads and where patient safety directly benefits. Let's start with the depth of anesthesia monitoring. The BIS monitor, bispectral index, has already using signals processing to condense EEG into a number. But now, next generation devices like Medtronic's SedLine are using multi-channel EEG with more sophisticated AI algorithms to give us a far richer picture of the brain state. And they are getting better at distinguishing true unconsciousness from suppression artifacts. Then there is hemodynamic prediction. The Acumen IQ platform by Edwards Life Sciences uses AI to predict hypotension before it happens, sometimes up to 15 minutes in advance. It's called Hypotension Prediction Index, or HPI. In studies, it has been shown to reduce intraoperative hypotension episodes significantly. This is not a small thing. We know hypotension is an independent predictor of complications, including acute kidney injury, MI, and even mortality. That one still blows my mind a little. The machine warning you about a hemodynamic event before the patient even shows clinical signs. It's getting like a weather alert before the storm rolls in. On the respiratory side, AI is helping with smarter ventilation. Systems now analyze lung compliance in real time and suggest protective ventilation strategies dynamically, adjusting for changing conditions, not just following a preset protocol. And let's talk about alarm fatigue for a moment, because this is huge. Any anesthesiologist will tell you the cacophony of alarms in an operating theater is a safety concern. Alarm fatigue leads to missed signals. AI is now being used to intelligently filter alarms, learning which alerts are clinically meaningful for that specific patient context and suppressing noise. It's called context-aware alarming. Philips IntelliView systems have been experimenting with this, and early results are genuinely encouraging. Fewer false alarms means more trust in the alarms that do fire, and that's a real safety win. One more thing here, neuromuscular monitoring with AI. A traditional trainer for interpretation requires your attention and a bit of judgment call. Newer devices now use AI to automatically interpret trainer for responses and flag inadequate reversal, thus reducing the risk of postoperative residual curarization. Simple, effective, underappreciated. Okay, everyone, documentation. The part of our job that nobody loves but everyone must do. And this, honestly, is where AI might save the most time in the near term for an average anesthesiologist. We already discussed about it in our previous episode in detail. Enter AI-powered anesthesia records. Modern anesthesia information management systems, AIMS, like Merge Anesthesia, Epic Anesthesia, or Drager's integrated systems. These are increasingly incorporating AI to auto-populate the anesthesia record in real time. The machine captures your drugs, your vitals, your ventilatory settings, and structures them into the legal documentation automatically. No manual data entry. And now there is a newer frontier, ambient voice documentation. Companies like Nuance DAX and Suki AI have created ambient AI scribes that listen to the clinical conversation, understand the context, and draft structured notes. They are primarily targeting physicians, but specialty-specific versions for anesthesiology are emerging. Remember, it's your duty to review and sign off. That's how you take the help of AI intelligently. And now the segment I know many of you tune in specifically for, the AI hack of the week in rapid sequence intelligence. Let's look into Google Notebook LM. This is your great research assistant. Suppose you search for, say, IDA guidelines and you get the article in IJ. Now you can see the PDF version and you can see how many pages of information is there in the write-up. It's been an excellently prepared guideline from stalwarts in India regarding difficult airway management guidelines, but it's a little too exhaustive. Now our idea is to make concise information and to enable faster learning. So what you do is go to Google Notebook LM, create a new notebook, and then upload your PDF document. Now you can download the downloaded PDF version, and now the AI actually reads through the document and prepares the output as per your liking. Now you can see a brief summary of the article is appearing in front of you. You can read through it very quickly. This is simply based on the article you uploaded, not from, say, hallucinating links. And you can actually interrogate with the AI for further clarifications. So you can click on the sub-questions suggested, or you can type in your query and you will get the answer in a nutshell. You can also have different formats, facilities like generating mind map. You can have audio review, video review, etc. Mind map is something that excited me, because after you learn something, if you create a mind map like this, you actually go deep into the subject and keep it in your memory in a structured manner. I'm not advising you to go for this Google mind map every time. You get some examples and then start creating mind maps on your own later on if you are a resident. Okay, another option is you can generate quiz or MCQs out of it, and you can get clarity of the subject. Once you attempt a few multiple choice questions and you get right or go wrong, you get answers with explanations. So you will get more precise comprehension of the topic that you downloaded from the journal. As I mentioned, it's not only about creating quiz and mind map. Other options like creating a audio review, a video review, flashcards, slide decks, and all new features are there with Google Notebook LM. I would request all the residents or academic enthusiasts to just have a look at Google Notebook LM and enjoy the features. You'll really like it. Here actually you can see how an infographic is created from a particular topic, so that after your lecture or a communication or your class, the student will try to or tend to retain what you actually wanted to deliver, and it's all there in a beautifully graphically depicted fashion, the infographic option in Google Notebook LM. That's the AI hack for this week. These workflow innovations can truly transform your day-to-day practice if incorporated into your routine. It is important to remember that artificial intelligence is not here to take the place of your clinical expertise. Instead, it serves to enhance your efficiency and extend your capabilities, allowing you to achieve more within the same time frame. With that, we would like to thank you for spending your precious time with me. In our next episode, I'll be hosting a pro-con debate on the use of AI in anesthesiology. Your feedback and suggestions are always welcome. Please share them with us by emailing sanishpj@yahoo.com. Take care, everyone. We look forward to seeing you in episode 5.